Now let's turn to one of our headline stories for today, and a special report by the Auditor General into the management of mental health cases makes some worrying revelations. Topmost is the inadequate and erratic supply of medicines needed to improve the conditions of patients. Now, these are medicines that the Mental Health Authority make available to mental health facilities. The report notes that the situation has forced caregivers to pay for these drugs when they are supposed to be free per the Mental Health Act. And that is definitely posing some challenge to the treatment of mental health cases. Let's go onto the phone lines now and speak to Humphrey Coffee, who is the Executive Secretary of the Mental Health Society of Ghana. Mr. Coffee, I'm grateful for your time this morning on News Desk. This must definitely be worrying. The Mental Health Authority has a myriad of challenges. To see that the essential drugs needed are not being provided can only make it worse.
Yes, thank you very much, and thank you for having me. Indeed, you are right, and we thank the Auditor General for bringing this issue to public attention. We have, over the years, been having discussions with government and have been advocating strongly, especially when cases are becoming worse because people are relapsing. And that's why you would be hearing in recent times how people with mental health conditions who have relapsed are also attacking others and threatening others and making themselves their life treacherous as well as the public as well. So the issue is that we have, the mental health law has prescribed that there should be funding or specifically for mental health, which is a mental health fund.
Yeah.
Now, this fund has nothing virtually in it, and it's supposed to actually take care of some of these things. Now, we know that the mental health law itself says that the provision of mental health services, including medication, shall be free. It is the same policy that has been extended to the law itself, that is Act 846, saying same. But then when you go to these facilities, the medicines are not there. We ask the question, is it the procurement, is it the cycle of procurement, or is it that we are not able to project how many of such medications we need at a point in time? That is causing the shortage, because this shortage has been perennial. I mean, this is not the first time. Every year, we have shortage of medications. If you go to the look and cranny of this country, where mental health services are supposed to be provided, there's virtually no medication. So how do we take care of the people when we know that the policy says it's free and the law itself is reinforcing things? And people are working and relapsing and causing threats, creating mayhem to themselves and also even to the general public.
Let's look at the mental health fund. So the law states that there should be a fund for the purposes of supporting mental health care. But I guess, correct, how to raise funds, how to raise money into the funds as what has become the challenge here. Given the current economic conditions in which we are, I'm wondering if you have thought of creative ways by which government can raise these funds and populate the fund so that we can have money to take care of these, issues of medication.
Thank you very much, Ernest. We have made several proposals through the Ministry of Health. That one, we can put some small margin of tax on alcohol, cigarettes, etc. Specifically, some of these things, or we can create a system where the rich will contribute towards mental health, because there should be a way which is very sustainable, which will avoid a situation where there is frequent shortage of medication. Because look, if we sit down as mental health cases are rising and we do nothing about funding and we do nothing about provision of psychotropics, then the country should be looking towards a large number of people who will be on the streets, because already the numbers are increasing. There are people who are suffering from same, but because they are not either naked or because they are not talking to themselves, we don't identify them. But there are several others, including drivers, who are going through this condition. And if you're saying that the policy says it's free and the law says it's free, why are we not making the necessary provision to ensure that it's available for those who require it, so that at least we reduce the risk of increasing mental health conditions in the country, and also ensuring that there's productivity, because people are sitting in their offices, but they are suffering from mental health conditions. It's reducing the productivity of people, even in their offices. So there is a need for us to revamp mental health Although I will say that, I mean, some significant increase has been allocated in terms of budgetary allocation from the Ministry of Health to Mental Health Authority because in the past it has been negligible. It is still not adequate. We are not getting what we need that will make mental health good in this country.
And still on the issue of funding, in recent times, there's been a push to get marijuana, the cultivation of marijuana, legalized. And some have said that we could actually place taxes on this cultivation, and that could be a good way of raising money to deal with mental health issues. I'm wondering where you stand on this.
Interesting. These are interesting proposals that have run through over the period. But I tell you, if you go into the second cycle institution, the number of students that are taken to hard marijuana and we, as we call it, is becoming very, very treacherous. Students in the second cycle institution are managing to take marijuana into their chobuses, into their trunks, and taking it into their schools. And they are taking it, and it's having effect on their learning. It's reducing their ability to even stay on campus. You had these gentlemen who it wasn't in Kumasi or something that they just took a gun and already they had been sacked from the school, forgotten the school, and they now went and hijacked somebody's vehicle. Most of these students that act that way are under the influence of substance, and that is what we should be checking. Now, if you allow, even now that it's illegal, look at what we are experiencing. Then you say that the floodgates have been opened. Can you imagine what will happen on our street and even in our institutions?
Mr. Coffee, thank you very much. That's the Executive Secretary of the Mental Health Society of Ghana, Humphrey Coffee, speaking to us now on the Auditor General's report on the Mental Health Authority and the fact that they are being starved of essential medicines.